Welcome to Newsfeed. My name is Linda Alela. Time to update you on what is happening on Matters News right here. We have so much in store for you, even as we continue following up on the stories that are developing. Welcome once again. My name is Linda Alela. And now let's start off as the High Court has ordered a retrial of former rugby players Frank Wanyama and Alex Obara, who had been sentenced to a 15-year jail term for gang rape. In a fresh ruling, the court has noted that the existing records do not show whether one of the witnesses was sworn or not. The two had been sentenced to 15-year jail term last year for the alleged raping incident that happened in 2018. All right, moving on, almost 50 fishermen along the island of Lake Victoria have turned into agriculture as a way of avoiding the ill practice of exchange of fish and sex. This has been contributed by a number of challenges, including the directives by the government on fishing and scarcity of fish in the lake.
Watu wengi walikuwa wanapendelea mambo ya lakini tangu tuingie hapa na tuanze mambo ya nyanya, mambo ya mboga, lakini sana sana mambo ya nyanya na mboga, unapata kama watu wengi wameachiliwa na mambo ya hivi. Sasa wanafanya katika mashamba yao.
Sometimes you can go to the lake but you get it is raining while you are doing fishing, but you don't get much fish that can sustain the family. But we adopted this because it yields too much.
And at least 10 deaths have been reported during the enforcement of COVID-19 pandemic. Police have been linked to the killings as they enforce measures put in place by the government. The Kenya National Commission on Human Rights says that several cases have been reported in Nairobi. Let's listen in to a press conference that was held earlier today in regards to the same.
7 thematic areas. The first thematic area that we are looking at is the enforcement of COVID-19 prevention and control measures. In this one, we'll be able to inform the public on how and the efforts the state made to cushion the Kenyans during this time. And the Commission will interrogate any proposed drafts and amendments and the advisories that we shared to the state to be able to ensure that while we implement the protocols to contain COVID-19, these had to be contained within the law. We also, in this report, we have looked at access to justice, and you are very much aware that the usual way of doing things, especially accessing our courts for dispensation of justice, was also affected, and therefore we have looked at this and the measures that were put in place and the extent to which they have responded positively and expeditiously to the enjoyment of the rights of Kenyans in accessing justice. We have also looked at the media and access to information, where we have documented, for example, the challenges that the media personnel faced, especially in the initial stages, and where they also fell victims of the excesses that were meted on them by our security agencies and others who were ensuring that the COVID-19 protocols were enforced. We have also looked at education, and we are very much aware that our schools and colleges had to close down, and even the children are still at home. And we did provide an advisory to the Ministry of Education with regards to the measures they need to put in place before we think of opening our schools. We have also underscored the fact that in as much as there is online learning among a number of schools, especially the private ones, we have noted that those public schools, the coverage is not as good as it is in a number of private schools, and therefore issues around equity in accessing education at this period in time has also been compromised. Then we have looked at the labor and social security as well as housing, and also we did note that during this lockdown a number of people have been affected. A number of people were evicted from where they were staying for either failure to pay their rents or in other circumstances where we had evictions that were conducted by our own government. And we also did issue a press statement with regards to how this should be conducted in line with the eviction guidelines that are already in place in the country. And we also underscored the fact that evicting people during this time of COVID-19 was also exposing them to contracting the disease. We have also looked at the health facilities and the responses that have been given, and we applaud the Ministry of Health for the steps they have taken with regards to informing the public on the various steps they need to take to protect themselves. But also, we have underscored the fact that preparedness, especially at the county levels, has been very slow, and these are the areas that need to be addressed as we go forward. And finally, we have also looked at the vulnerable groups, and indeed it is very clear from our monitoring that we were not adequately prepared as a country to handle the vulnerable groups in terms of containing the COVID-19. And in as much as we applaud the measures that have been taken by the government to have cash transfers, for example, and all those cushioning from the initial stages, there was a huge gap, which then exposes us in the way we respond to the rights of vulnerable groups. So those are the 7 areas that our report is going to focus on. And when Director Anne comes up, she will be able to share with you the statistics. As I conclude, let me just pick 1, 2, 3, or 4 key recommendations that we are making in this report. The first one is that the National Emergency and Response Committee on COVID-19 prioritizes and strengthens actions aimed at cushioning vulnerable persons against marginalization. 2, strengthen law enforcement agencies through capacity building to ensure that they enforce regulations within the law and avoid human rights violations that have been witnessed. And here you are going to see the statistics in terms of the violations. Who tops the list in those violations? 3, the National Council on Administration of Justice continuously reviews actions and activities of court users to enhance access to justice, specifically enhance ICT services to Kenya Prison Service to fast-track remote hearing of cases to reduce on the backlog that has been occasioned by the lockdown. Additionally, ICT support to be given to the Department of Children's Services and the children courts to ensure evidence is secured and cases heard and determined in a timely manner.
Are currently unemployed due to the ongoing COVID-19 pandemic. 42% fear that they will not be able to be in a position to afford food if the virus and COVID-19 restrictions persist. Mwangi Maina reports.
The research indicates that 69% of Nairobians have reported reduced earnings, attributing it to COVID-19 pandemic. 43% have lost their jobs, with 94% reducing expenditure on food and non-alcoholic drinks. 6% of the city's low-income earners are the only ones able to save, whereas 80% were able to save before the pandemic. 20% have reduced their rent expenditure, while 18% have reduced their clothing expenditure. Entertainment and transport expenditure has reduced with 10% each among Nairobi's low-income earners. In the event the virus persists, 42% of those living in low-income areas are at a risk of facing hunger, with 28% foreseeing a loss in income. 9% fear they won't be able to pay rent, while 6% have the fear of their children missing school, and 4% foresee an upsurge in crime and insecurity. 579 respondents were interviewed from low-income areas in Mathare, Kawangware, Kibra, Korogosho, Huruma, and Mukuru kwa Njenga. Mwangi Maina, TV47, Nairobi.
And to a rather interesting and equally unfortunate story, an attempt to access a bank by suspected robbers in Kikuyu, Kiambu County was aborted after a wall they were drilling collapsed. The suspects had drilled a hole from a rented house into the bank to gain entry. The wall of their house collapsed, alerting their neighbors and security officials.
The plan of suspected robbers trying to gain access into a bank in Kikuyu failed after the wall they were drilling collapsed, raising an alarm.
What happened is that this was on Saturday, and there was an alarm coming from the bank. That has drawn the attention of the security team and the entire neighborhood. However, they could not gain entry into the bank.
Kiambu Police Commander Ali Nuno has confirmed the arrest of one person linked to the bank robbery plot after robbers trying to gain entry into the bank by drilling the wall from their rented house that is next to the bank.
We made efforts to call the manager, Wanjiru, and this morning when she came, we opened the bank. It was discovered that there was a hole which was drilled from the bank into the neighborhood, in the rented houses. One has been arrested so far. Investigations are underway.
Nuno has warned residents and those in the financial sector to be keen, saying that such crimes have started becoming rampant.
And I want to caution the general public and also the commercial sector, the financial sector. The financial sector should always be conscious of these crimes which have been committed within their neighborhood.
Muhammad Ali, TV47.
And from that story, Newsfeed takes a short break. We'll be right back with more news. Thank you so much for choosing to stay with us. Let's move on now. Residents of Kapsiwet village in Kwanza constituency, Trans Nzoia County, have lamented of poor service delivery rendered up to Kapsiwet Health Center. Boniface Baraza with the details.
The frustrated resident led by Gilbert Mnyalo revealed that the staff quarters that was built for nurses and other health officers posted to serve in the facility have been converted into rental houses for non-medics, affecting service delivery at night.
Mambo ya nyumba ambazo siko hapa, tunajua kwamba kama saizi hata vile mlikuwa mnamulika, mnaona ya kwamba kuna nyumba imeandikwa CDF. CDF tunashindwa ni ya serikali ama huyu sister alikuja naye na akajenga ndipo aanze kurendisha hizi nyumba ambazo madaktari ndakano waishi ndani. Sasa hivi tunazungumza hivi hata kuna daktari, kuna sister anakaa nje ya hii boma na nyumba siko ndani ya hii boma. Kwa nini masista wasikuje wakae hapa ndani na kazi ifanyike 24/7? Hizi lenye tumefikia ni kusema ya kwamba Sister Flora must go.
The residents say they are forced to buy medicine outside the facility. They are now calling for restructuring of the management of the health facility.
Hata siku ya leo nyinyi wenyewe mmechonea na maji ya kuona ya kwamba gari imekuja na imeleta dawa, lakini mgonjwa sasa anatoka hapa na kitabu kwa mkono anaambiwa endo ununue dawa. So hizo dawa zenye zinakuja na gari zinaenda wapi? So tunataka tuambiwe ukweli. Huyu mama ametunyanyasa vya kutosha, ameuza madawa.
Nikuja kwa hospitali na dani nitatibiwa. Mara mingi nafika naambiwa niende ninunue dawa. Leo nimekuja hapa nimepimwa niko na malaria. Wananiambia niende ninunue dawa. Sina pesa, nitafanya aje? Hata kina mama pia wanatatizika, wanakujanga hapa. Kama kuna mama last year alikuja hapa hivi kuzalishwa. Aliumia, gari kakuja ikampeleka district.
What ails the most is the poor health services which denies them the right to the highest attainable standard of the health as enshrined in the Article 43 of the Kenyan Constitution.
Kitu kila ambacho tunaomba, kama kweli ni health center, tafadhali tunaambia serikali yetu ya kaunti kuwa wafanye 24 hours. Wasitudanganye kuwa ni health center ili hali kumbe ni kibao bure kimebandikwa pale.
Na yule huyu Flora ambaye ndio nasi wetu hapa, kwa upole tu arudi penye alikuwa afanye kazi huko. Tumechoka naye hapa, punda wamechoka bana. Hatuna msaada yote hapa. Nyumba za hospitali hapa ya madaktari imekuwa ni biashara. Saizi imekodishwa watu na wanaishi ndani. Madaktari wenyewe wanaishi nje ya hospitali. Ukija hapa usiku mpaka asubuhi.
This comes after the facility was upgraded from the status of dispensary to a health center. Boniface Barasa, TV47, Kapsiwet Health Center, Kwanza Sub-County, Trans Nzoia County.
Now, residents of Crossroad and Jawado areas in Njoro, Nakuru County are accusing security personnel of protecting notorious illicit brew suppliers. According to the residents who sought anonymity, crime, open circulation of drugs and illicit brew has been on the rise, with no action being taken by the police. The distributors are said to have been posing threats to anyone who wants to expose their mischief with the locals or within that locals. And of course, the locals are now living with fear.
Residents of Njoro in Nakuru County have decried of increasing illicit brew dealers in the area who have been posing threats to anyone attempting to expose them to authorities. They now allege that the area police assigned to crack down on the drugs have been compromised, with those speaking up about the matter being threatened or killed.
Watu zaidi ya 13 ambao mimi nawajua wenye wamekufia hapa, lakini kuna wengine ambao huwa wanakunywa ile pombe, maana ile dawa ni sumu, ile pombe ni sumu. Mtu anakunywa anaenda na kufia nyumbani. Sasa wale wakukufia nyumbani hawajui.
They are now calling on for a transfer of all the police officers in the area, saying that if no action is taken, they risk losing their children to the drugs and alcohol. The area chief has had a hard time controlling the circulation due to compromised police officers.
Suluhisho ni hawa maskari wote waweze kupigwa transfer watoke hapa. Ingawa hata wakipigwa transfer kwenye bado wataenda, hawa watu bado wataendelea tu kuendeleza hiyo biashara ya uzaji wa pombe na bangi, kwa sababu hatujui hapa polisi wanatoa wapi bangi hizi wanaenda kupatia vijana wa shule.
They are now calling on the government to intervene, saying the youths are slowly drifting away due to drugs and cheap liquor being sold to them.
Watoto wetu wanalepiwa, hata vijana pia wako katika hatari, kwa sababu akilewa hajijui yeye mwenyewe, kwa hivyo atalepiwa tu na wengine. Kwa hivyo mpaka watoto wetu wako hatarini.
For TV47, my name is Nanok Lauren.
And from illicit brew to matters, so cigarettes, tobacco, name them, more than 10,000 people die every year from the use of tobacco in the country. Now, the Kenya Tobacco Control Alliance says that this is due to negligence from the government towards the regulations of tobacco use. They have blamed the Ministry of Health for not enforcing the law.
Serikali imekuwa katika mstari wa mbele katika kuvunja sheria zinazohusiana na udhibiti wa tumbaku kupitia kwa maafisa ambao wanastahili kuhakikisha ya kwamba sheria inazingatiwa. Na kwa kuorodhesha tumbaku kama bidhaa muhimu katika nchi hii wakati huo tunapopambana na corona, waziri wa viwanda na biashara ameonyesha wazi ya kwamba anaunga mkono kile kitu ambacho kinaangamiza Wakenya 9,000 kila mwaka.
And drama unfolded in Pate Island after Lamu County Woman Representative Ruweida Mohammed took to the Faza Diesel power station demanding power to be restored in the entire island following a blackout that occurred since June the 9th. Mohammed, together with over 100 residents who were angered by the Rural Electrification Authority and KPLC officials, spent the night at the power station and vowed to stay until power was restored, despite assurance by authorities that it would be restored on June the 27th.
Tutia tamaa kuanzia jioni kwamba watatupa moto baada ya kupotea kwa muda wa mwezi, na tumekaa hapa mpaka muda huu bado tuongojea tukitaraji moto utawaka, lakini mpaka sasa wametuambia kwamba wao wameshindwa na kazi, waenda kulala. Sisi tumeamua tutakesha hapa mpaka usubuhi, mpaka wahakikishe kwamba wametoa moto, na kesho ikiwezekana tufanye maandamano kumlani msimamizi ambaye kwamba anafanya kazi duni katika kituo hichi cha hapa Faza kusimamia mambo ya usambazaji umeme.
And Muslim leaders have opposed the proposed reproductive health care bill. The Muslim committee says that they oppose the bill because it has hallmarks of mischievous attempt of pushing for the adoption of foreign ideas or ideals. They are asking the government to engage religious and all stakeholders on the matter. The bill is proposed by Nakuru Senator Susan Kihika.
The part of the article providing including reproductive health care is not necessary and should also be repealed, as it is the avenue to legalize abortion in Kenya. The Muslim leadership also calls for the government to shelve or withdraw the National Adolescent Sexual and Reproductive Health Policy of 2015 and re-engage religious and all other stakeholders in coming up with a new policy that is religious-friendly and cognizant of our cultural values as Kenyans protect our moral fabric. The bill should be withdrawn altogether.
And that's all we had for you right here on Newsfeed. Thank you so much for keeping me company. We have so much so on Matters News later on our subsequent bulletins. Thank you so much. Once again, do enjoy the rest of your viewing. My name is Linda Alela.